My preferred and favorite type of brow lift is the forehead lift. So this is done by making an incision along the hairline, right along where the forehead meets the anterior hairline or your front hairline, elevating the forehead tissue down towards the eyebrows and then lifting that whole sheet of skin upward to get the eyebrows to the desired level, and then the extra forehead skin is removed. So this does leave a scar right along the hairline. However, this is the only brow lift technique that does not make your forehead longer and does not move your hairline further back. Another nice thing about this technique is that I can do it under numbing medicine. You do not need to go to sleep for a forehead lift because I can numb up all of the tissue that I need to manipulate to do the operation. Lastly, because the extra skin removed, the extra forehead skin that's removed does all the fixation, meaning rather than leaving all the tissue in place like with an endoscopic brow lift, we are removing the extra tissue, which is the extra forehead skin along that incision, so there's no need for any hardware or fixation to hold everything in place. The fixation is the removal of the extra skin that you don't need or want. And as a result of all this, your forehead actually will get shorter and your hairline will come forward. So this is a good option for people who don't want to go under general anesthesia and people who don't want to have their hairline moved further back or their forehead longer, because this technique will actually move your hairline a little bit forward and make your forehead a little bit smaller. So those can be benefits if you have a longer forehead and a receding hairline. The other nice thing about the forehead lift or that technique to elevate the brows, because it elevates the brows and gets rid of the extra forehead skin at the same time, is that the incision is continuous with a facelift incision. So most of my patients who get a brow lift are also having a facelift performed at the same time. And so the incision is continuous with the facelift incision, which lets all of the skin and everything redrape nicely. So in summary, forehead lift does a nice job elevating the forehead. It can be done, forehead and eyebrows. It can be done under numbing medicine. It does not require any fixation devices or hardware. It does not require drilling any holes into your skull bone. And it leaves your forehead shorter and does not move your hairline further back. The major downside to the forehead lift, and one of the reasons some people don't like it, is that it is a scar along your hairline all the way across your forehead. Now, fortunately, this scar normally heals very nicely, similar to a facelift scar, and the scar is along your hairline, so it is not all that prominent. It is sort of hidden at that junction between your forehead skin where there's no hair and your scalp where you have hair. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.